Caffeine is a stimulant that attacks the central nervous system. A stimulant increases alertness in the brain, so kind of like what Adderall does. It's the number one most used psychoactive drug in the world. It enters the body orally and is absorbed into the bloodstream for short-term effects, usually lasting 30 to 45 minutes. Common examples are coffee, tea, energy drinks, sodas, capsules, pills, and powders. 80% of the world's population consumes caffeine, so this is why it is the number one widely used drug in the world. So its origin, it originates from Ethiopia when in the 9th century when a goat herder noticed goats getting energy from berries from a coffee plant. It comes from seeds, fruits, nuts, and leaves that are native to Africa, South America, and East Asia. And the coffee bean is the most well-known source of caffeine. So the history of caffeine itself, it was found by Ferdinand Runge, a German scientist, in 1819 when his friend Goth gave him rare Arabian mocha beans. And after months of different tests, he was able to isolate the caffeine supplement itself. And how it works. So as I already mentioned, it attacks the central nervous system by blocking the adenosine receptors in the brain. So you can see in the picture, it pretty much replaces the receptors so you can focus more. And as I've said, it increases alertness, mood, enhances cognitive function, and can help physical performance.
So there are a lot of benefits for caffeine, one being weight loss because caffeine acts as an appetite suppressant and also a diuretic. Caffeine can switch the substrate from glycogen to lipids, so it increases your fatty acid oxidation rather than mostly using glycogen. And a 2012 study showed a regular coffee consumption of 3 to 5 cups a day at midlife is associated with a reduction in the risk of dementia and Alzheimer's disease, up to 62 to 70%. Caffeine also allows for smooth muscle relaxation, which is important for normal functioning of respiratory airways, GI organs, circulatory system. Basically, it improves blood and oxygen circulation, so improving organ function. It stimulates glandular secretion, allowing sweat, saliva, digestive enzymes, and hormones to be produced. For athletes specifically, a 2012 study showed that there's improvements in time to exhaustion at 80% VO2 max with caffeine supplemented. It has also been shown to be ergogenic for muscular endurance, so caffeine can help with muscular endurance because it furthers exhaustion time. Strength, power, and speed is also improved. A 2006 study showed that 2 to 7% increase in strength and a 7 to 8% boost in power from caffeine during sprints with longer rest intervals. This is because of a 7% increase of lower body maximal contraction shown in athletes that ingested 6 milligrams per kilogram of body weight of caffeine. So strength and power movements can also be improved because the force velocity curve is almost always to the right with a caffeine supplement. Focus and reaction time can also be improved because caffeine has been shown to be ergogenic for cognitive function, including attention and vigilance in most individuals. It also helps muscle recovery, according to a 2008 study that has shown that 8 milligrams per kilogram of body weight co-ingested with carbohydrates has higher rates of post-exercise muscle glycogen stacking in well-trained athletes after the depletion of glycogen from exercise. This is because caffeine has the ability to increase adrenaline, enhancing energy. It stimulates fat oxidation, sparing glycogen source for longer endurance. It enhances muscle contraction because it increases calcium release in the muscle cells and increases focus and alertness through enhanced neurotransmitter activity and increased central nervous activity. It lowers the perception of fatigue, making it easier mentally to go for longer, and increases circulation, allowing blood and oxygen to flow more efficiently through your muscles and your extremities and such. But it does have side effects and risks. One being addiction, because caffeine is a stimulant. It's just like drugs. There are withdrawals, and you can develop a psychological and physical dependency on caffeine. It does increase your heart rate and can cause rapid heartbeat or shakiness. It can cause stomach problems and heartburn because it increases stomach acidity and can cause GI stress. It makes you pee a lot because it's a diuretic. It raises blood pressure because it stimulates the nervous system, and you may have trouble sleeping and anxiety. And women's fertility and pregnancy can be at risk with high amounts of caffeine. This is over 200 milligrams. It can affect fetal heart rhythm and reduce muscle activity in the fallopian tubes, which would affect ovulation. So addiction, caffeine is the most commonly used drug in the world. According to the NIH, 9 studies have characterized a caffeine dependency in the general population through craving, tolerance, which it means needing more gradually for its effects to actually work on you, desire, withdrawals, and overuse. Withdrawals include headache, fatigue, poor concentration, dysphoric mood, and cravings. Women's fertility and pregnancy risks. The NIH studies from 2005 to 2009 have shown more than 300 milligrams daily may lead to a loss of pregnancy, delayed fetal growth, and abnormal fetal heart rhythm, but less than 200 milligrams or around 2 cups of coffee is okay. A Wiley study in 2011 showed that excessive caffeine causes the smooth muscles to relax, including in fallopian tubes, meaning that it could affect ovulation, which is like an egg going down. And
so a case study was done back in 2017 by Stanford University because they wanted to see if caffeine counteracts the inflammation through aging through the immune system. So they took blood samples from about 100 people, testing the connection between caffeine and low-level inflammation. The individuals that consumed caffeine had lower levels of inflammation activation pathways because the adenosine receptors block these processes. So in conclusion from this case study, is drinking the appropriate amount of caffeine, so anything below 400 milligrams daily can pretty much help with aging. And then just cost and recommendations. So for Monster energy drinks, their suggested serving size is about 16 ounces, which has about 60 milligrams of caffeine per can. And they suggest don't go over the 400 milligram per day amount. And cost per serving is about $2.50 for the 16 ounce can. For Red Bull, serving size is about 8.4 ounces or 80 milligrams per can. And they suggest having 1 or 2 cans daily without going over the 400 milligrams per day amount. And per serving, it's about $2.59 for this can. For Starbucks, so their serving size is 16 ounces or 310 milligrams per serving. And they also suggest don't go over the 400 milligrams daily. And cost per serving is about $3.65 to $4.65 for a grande or a medium. And caffeine pills, one serving size is about 1 pill, which is about 200 milligrams per tablet. And they suggest to take 1 tablet every 4 to 6 hours, not exceeding the 2 to 3 daily. And for cost per serving, on the Amazon 16 pack is about $4.47, coming out to 28 cents per serving. And then for Folgers coffee, the serving size amount is 8 ounces of coffee, which is about 2 tablespoons of the roast. And they suggest 120 milligrams per 8 ounces of serving. And this container you see on the screen is about $10 for 30.5 ounces. And there's about 380 servings in this, making it $3 per serving. 30 cents per serving. So our thoughts, so I think caffeine's a good supplement to take because I have some every day. because it increases alertness, mood, cognitive function, and increases physical performance. But I don't suggest taking more than 400 milligrams a day.
I personally do drink and would recommend caffeine, especially for athletes. I think it's really important to drink moderate amounts when necessary and avoid overconsumption, especially if you're pregnant or have high blood pressure. And then these are our resources.